Welcome to iSpa Talk, where we educate, empower, and encourage women to practice safe beauty habits, starting with their eyes and skin. I help you connect the dots between beauty and science. Some say your eyes and skin say more about you before you open your mouth. My name is Dr. Janelle O.D. I'm your host and the CEO and founder of Bring Eyes Vision Center and Premier Dry Eye Spa. Thank you for tuning in. Let's chat. Hey, happy Sunday. How are you today? How are you going? How's everybody doing? It is already dark outside. I'm so not used to the dark. I'm getting used to this fall back lighting, but I'm trying to go live on Instagram. Looks like we're live there as well. So come on in. How is everybody doing today? Hopefully you can hear me okay. Let's turn this volume up. Well, for those of you who do not know, I'm Dr. Janelle O.D., your eye care expert. I'm the CEO and founder of Bring Eyes Vision Center and Premier Eye Spa. And also, I'm the founder of iSpa Talk. Yes, we have the paraphernalia. So today, we have a great show for you today. Go ahead and put your notifications on, tag your friends. Sharing is caring. Because we're going to learn about a new product that's on the market that is offered in our iSpa. So for those of you who don't know, I own Bring Eyes Vision Center. I've been practicing now just under 15 years in the Metro Atlanta area, and 10 of those years I've been a solo private practice owner. And then 2 years ago in 2018, I launched an iSpa within my practice. So we've relocated to the Shops at Belmont in Smyrna. And we have a beautiful optical, but also we offer a very unique iSpa experience where we do all of our advanced dry eye services. But what makes us extra unique is that we offer aesthetic services. We have a lash esthetician that comes in. She's a licensed esthetician. She comes in and does individual lashes, brows, facials. We have it all. And in 2021, we're going to be bringing in IPL. So stay tuned to learn more about that. But today we're talking about UPNEEQ. Anybody on here familiar with UPNEEQ? Welcome to iSpa Talk, where we educate, empower, and encourage women. Didn't want to see that. Let me get my comments. So if you have any questions, go ahead and put your comments in the comment box. I should be able to follow those. Also, if you have any comments, I'll be watching Instagram as well. A lot of people are tuning in on Instagram. Go ahead and put your comments in, and I'll try to make sure I look at Instagram as well to see what the comments are. Typically, I only go live on Facebook, so bear with me as I'm trying to toggle back and forth between Facebook and Instagram. But today we're going to be talking about UPNEEQ, which is a new drop on the market that launched in September. So right around the end of August, September. And so we're just now really getting to learn a lot about this drop. It's really starting to hit the market. It's been a slow release into the market because of COVID. And so I have been able to get this drop in our office, and I would say thank you to Dr. Chandra Mickles, who works in Nova. She does the Dry Eye Center in Nova. I have been trying to contact whoever our rep was here in the Atlanta area, and she immediately got on the phone, contacted the rep. Within a few hours, I had marketing, rep, everybody at my door. So UPNEEQ is a drop. And so what I'm going to do is I'm going to put a drop in my eyes. Normally, you guys know when you come in, I have lashes on, but I didn't put it on because I know I'm going to put a drop in my eyes. So before I put a drop, we're going to talk about a little bit what UPNEEQ is used for, because I want to put the drop in, and then I'm going to do a real fancy photo so that way we can see before and after. So UPNEEQ is a drop. It's a new drop on the market. So let's see if you can see this here. It comes in individual vials. And the purpose of the drop is to help with droopy eyelids, okay? You guys can't tell, but I can. I have a little droopy eyelid, and it's more on my right eye. And so I've noticed as I've gotten older that one of my eyes looks smaller than the other. And so my lid droops. And we're specifically speaking of the droopy lid or the droop in your top lid. So there's a few reasons why you can have a droopy lid, right? You can have a congenital droopy lid, which means you're born that way. So 9 out of 10, if you're born with a congenital droopy lid, the muscles that innervate the eyelid to lift your lid just didn't develop all the way, or they didn't develop at all. So you have a droopy eyelid. You always look sleepy, right? Or you can have what's called an acquired, the big word is blepharostosis, but we call it a droopy eyelid in layman's term. over time. And there's several reasons why you can have a droopy eyelid over time. One big being is age. You know, I'm not that old, but I'm in my 40s, but just like everything else, muscles, ligaments, nerves, everything changes as we get older. And the eye is no exception. I always tell my patients, as you can visibly see the changes in your body and your skin, the same thing is happening in, around, and in the back of the eye. Some of you can't physically see. This particular one you can't see. So I have a lid that just tends to droop a little bit, and I've noticed it more as I've gotten a little bit older. You can have a injury. So sometimes a past injury just can cause that muscle where it's not as effective and it tends to droop. Toxins, Botox. So if you have a Botox injection and somebody is not really skilled, or, you know, for whatever reason they hit a special muscle that allows your eyes to be elevated, you can have a droopy eyelid after a Botox injection. Sometimes glaucoma drops that you take can cause a droopy eyelids. There's fatty tissue around the eye that helps to give your eye the shape and actually give your lid a little bit of strength in the lid muscles. That fatty tissue can change and move as you continue to take that drop. And there's a certain class of drops that do that. So you may notice over years of taking glaucoma medications that your eyelid tends to droop a little bit. And then there could be some things that are a little bit more sinister, like some neurological issues, a condition called myasthenia gravis, or some autoimmune conditions and diabetes. So if you have a droopy eyelid that is acquired, that means you weren't born with that. You want to first just make sure that you don't have any other physical conditions going on that could be causing your eyelid to droop, because you don't want to cosmetically fix the eyelid droop and not deal with the underlying issue. So that's one thing, right? So if you think you have a droopy eyelid, there should be two people that you should be visiting. Your primary care doctor, one, to get some blood work, just to make sure you don't have any underlying issues going on that could be causing your lid to droop, and your eye doctor, your optometrist, because now they can help. So before UPNEEQ, the main standard of care was surgery. And depending on how the level of your droopiness was, so I'll show you this little guide here. They give you this cool guide to be able to show your patient. So if you guys can see this, just the level of the droop, right? So this here is a normal eye appearance, and then you go all the way across to a really bad droopy eyelid. You can see how it breaks down what is considered like in an aesthetic mode, meaning which we can help, and where UPNEEQ will probably be the best option for you. I'm going to show Instagram followers as well. So we have a normal, normal, then we go all the way over and we have a droopy lid, and it's telling you where UPNEEQ is going to work the best. Over here where it's really droopy, you can do UPNEEQ. I've seen some cases where it's worked very well, and we'll talk about why it's an alternative to surgery. One being that surgery is pricey. So unless the surgery can be proven that it's medically necessary, and medically necessary means that there's a medical reason that's causing your eyelids to droop, and they're drooping, and now they're severely impacting your vision and your daily life function, specifically driving, then you may qualify for a lid lift surgery. That's a cosmetic procedure that will help the droopy lid, and that's over here, right? If you have that and you cannot prove really that's affecting your daily life function, it's considered a cosmetic surgery. And they usually can cost anywhere, I would say, $2,500 to about $4,000, all right? So a lot of people don't have the extra cash, or they're afraid for surgery. Surgery, even though it is minimum, surgery at any point is invasive. You have risk for infection, and also you have risk for its overcorrection of the lid. So that way when it's time to go to sleep at night, now your lid doesn't close all the way and cover the eye, and then you end up with exposure dry eye, where you don't do it well enough, and so you have the surgery and it still didn't really fix anything, or like I said, infection. So having surgery is a standard of care until recently. So now we have another option. So what happens, I'm going to put the drop in so that way you can see, because I need to do, actually let's do it before pictures before we do the drop. So we have this special device here that you'll get, doctors, if you use the UPNEEQ and you qualify to be able to have this in your office. The way the UPNEEQ works, UPNEEQ is the eye drop, and it's a oxymetazoline hydrochloride 0.1% solution, right? And it acts on the alpha adrenergic receptor agonist. So that's how it works. That's doctor talk. So if you're a doctor watching this, that's how the drop works. And it does work. I have a mild ptosis. So what you do, you get this nifty device here, and it's going to allow us to take a before and after picture. So you have a password that you have to put in, and see the device will come up, and you can do it in selfie mode, or you can take the picture for the patient yourself. But when you do this, it's important to take the picture before, so that way you can see if it actually works. And if it works to the level that the patient wants, or that you, as if you're already a patient that you like, then the drop can be prescribed for you, which we'll talk about how you get it and how much it costs. So I'm gonna do the selfie mode. So you hit that, then you hit next. Of course, stuff don't never want to work when you, there we go. And so it basically gives you instructions on how to take the photo. So can everybody see me here? Let's see here. So I'm going to bring it down. So basically you take a selfie like a regular picture, and it's going to tell you what to do. So it's telling me to move it closer to the camera, move my face closer to the camera. And it automatically took the picture. So it's all automatic. It automatically took the picture. And when it takes a picture, it takes a special measurement to see exactly how elevated your eyelids are. So it looks at the overall aperture. And so next it tells you what to do. So you can retake the picture if you need to. And when you need to retake the picture, it's because the green dot has to be in the center. So if the green dot is not in the center, then you'll take the picture over. But the green dot's in the center, and so then it tells you to put the drop in and start the timer. Typically, once you put the drop in, it starts to work within about 15 minutes. And some patients see an improvement within 5 minutes. So it comes in a sterile vial, right? So you open the sterile vial, and it's only enough for one drop. So we'll put one drop in. All right, good. So we put a drop in. And then once I put a drop in, we're going to start the timer. And then 15 minutes later, the system wants you to come back and take another picture. All right, so while the drop's in, we're going to talk a little bit more about UPNEEQ. So as a patient, you're probably thinking, when do you ask about this? If you've noticed a droopy lid over the last few years, doing your regular exam, you can mention it to your doctor. Or you could look ahead of time and see what doctors in the area offer UPNEEQ, or they are versed and they have the technology to be able to prescribe the drop to you. Doctors, if you want to prescribe UPNEEQ, it's really beneficial to have samples. So you definitely want to be getting up in your ear. That what you want to do in order to see if the drop really works for the patient before we prescribe it is they're going to leave all this stuff for you, so that way you can take pictures, put the drop in, probably have the patient go out and look at glasses, come back and take the after picture and see if the appearance of the lid is elevated enough for the patient for you to prescribe the medication. There are some things that you want to know in prescribing the medication. So one, when we put it in, this is the second time I've used it. It's only a once a day drop, and it lasts up to 8 hours. So it's not a drop that you put in multiple times a day. It's usually once a day drop. Now I have dry eye, so anytime that I bring anything to my office, especially if it's an aesthetic service, I want to know how it could potentially affect my patient's ocular surface and dry eye. Now, some of the studies, which we do have the study here, and they leave the study with you. And so doctor science study, I know some of you guys might be confused that you're listening over time, that you may think science doesn't matter anymore and studies don't matter, but they do. Okay, studies and science do matter. Let me get off a tangent. So we have the study here. So you can read through the study and see how many participants were in the study. It was a pretty robust study. They had 304 participants in the study. It was a double masked, randomized study, which is important. But when patients come in, you can ask this on your routine exams. In the event that the doctors are offering this, what they'll do is they will be able to take some before pictures, they'll put a drop in, and then we'll come back and take an after picture and see how it's working. One thing that you want to be careful of, and it doesn't mean that you can't use this, is if you have hypertension, Or if you're taking certain medications, you do want to make sure when you come in for your regular exam that you have your medication list, so that way if the doctor is going to prescribe the medication, this drop for you, that we know that we don't have any contraindications that may happen because of other medications that you're taking. So when I put the drop in, the first time I used it, which was last week, it stung just a little bit. I tell my patients that most drops, when you put them in, they sting. Very few drops don't sting. This drop stung the first time I put it in. Today when I put it in, it doesn't sting as much, but I will tell you, after about a couple minutes of the drop being in the eye, you can feel it kind of dispersing over the surface of the eye and kind of working its way in, and my eye feels a little bit dry. Some of the studies, doc, shows that there is a little bit of keratitis, mild, that is with the drop. Nothing that anybody had to be dropped out of the study or severe complications. But if you specialize in ocular surface disease and dry eye and you're prescribing this for patients, you do want to make sure that you are talking to them about the possibility of maybe some flare-ups. You make sure you want to put them on some tears in conjunction with the drop that they're using. Encourage them not to use it more than once a day, and it may be something that you don't need to use every day. This is not something that you have to use every day. You can. The study only went out to about 6 to 8 weeks, and nobody had any severe complications in that time frame. It went all the way to phase 3 trials. But you can use as much as you like, or as least if you like. So in a spot for in the cosmetic arena, you can use this like if you have an event, something's going on, and you want to be able to go and not have that sleepy appearance, especially if you're taking some photos or pictures, or if it's something that you really just want to not to have the focus being on, are you okay? Are you tired? You look sleepy. You can use this drop. You use this drop in the infected eye, and if you have both eyes that are a little bit droopy, you can use it in both eyes. It will work. But like I said, once it's in, the eye does feel a little bit dry. My timer is still going on, so I have about 10 minutes, and we're going to do some post pictures. A couple things, the way that the drop works. So there's a special muscle in the lid that's called Mueller's muscle that works to keep the eye elevated, the eyelid elevated, with a couple other muscles. Well, we won't go deep into the science and anatomy. Most patients don't care about that. But it works on the muscles, and it makes that muscle to elevate. So over time, muscles stretch, muscles get weak. So we always think about our knees. Our knees are not as swift as they used to be as we get older. Sometimes we have some hands and finger issues as we get older. The eye is no exception. The muscles in the eyes do stretch. They do not work as efficiently as they have in the past, and this is one eye. What is really awesome is that, if you can't afford surgery, which I said it could be anywhere from $2,500 to about $4,000 if this is considered a cosmetic procedure and not medically necessary, and you don't necessarily have to have a visual field to have this done. So if you fall in this mid to moderate range and you just want to improve the appearance of your eye, and you're not really interested in having a surgical procedure, then this drop UPNEEQ is great for you. The cost of the drop, so we'll go over it. So once we know that the drop works, the rep, which is really nice, Tammy is her name, in the Atlanta area, will leave these for you, right? So we have drops that we keep in the office for us to use on patients, but then once we know that it works and the patient is happy with the results, we have these cool little baggies that we give them with a few extra days of the drops that they can use while they're waiting to get the medication filled. So you're probably asking now, well, how much does the drop cost? It's actually at a good price point. If you offer any aesthetic services in your office or cosmetic aesthetic services, especially like lash boost, Latisse, any lash serums or any facial creams, they're going to be usually at least $89 on up. And this drop is no different. I have the price card here. This drop is not billable under insurance, right? So it's considered cosmetic, just like Latisse was when it first came out. You're not going to be able to use your insurance on it. But that did not stop a lot of people, especially women who are suffering from thinning and loss of lashes, to want to be able to use Latisse because it was not covered by insurance. But you can use your flex spending and your health savings accounts on here as well. But it's a special pharmacy that this drop comes out of that's called RVL Pharmacy. And what happens, RVL Pharmacy, when we know that this is going to work, you write a prescription and you can fax it over to them, or you can e-prescribe it to them, and they will get the prescription and contact the patient. And they have a couple different payment options for patients. So if you're a patient, you know you love and you're going to be taking it for a 90 count bottle. So that's 90 days worth of drops. It is $225, which is very reasonable for 3 months worth of drop. And if you're not going to be using it every single day, that's a good bit. And they're individual vials, so long as they're not expired, and all of them are going to have the expiration on the back, like this doesn't expire to 2022 July, the drop will last. If you're not convinced and you want to try just for 30 days, then the 30-day count or 30-day bottle is $105. So it's a good price point. We spend more than that if we get highlights put in our hair. Getting highlights in my hair, that's going to be a $115 minimum investment, and that usually doesn't include any styling or cutting. So as women, we're kind of used to spending those extra dollars to get the looks that we want. And so pretty good price point, but you can't just walk into CVS or Walgreens or whatever other pharmacy, Express Scripts. This has to go to RVL Pharmacy. One reason being that they can control the cost of the drop. It's a very good price point for a 90-day and a 30-day count or bottle of drops. If it's dispensed out of any other pharmacy, it's very difficult to control the cost. Right now, I don't even think it's dispensed out of your doctor's office. They have samples to be able to give you to get going, but you will need to have a prescription, and your doctor will need to facilitate that prescription getting over to this pharmacy. And then it's shipped to you because the pharmacy is not local to the Atlanta area, so it's shipped to you. And I believe, which I'll have to confirm, I don't think shipping is additional charge. It doesn't say, but I don't think you pay extra for shipping, but don't get mad at me if they charge you. I don't know how to do with that. But I don't think it's extra for shipping. But if not, it's shipped directly to you, and then you can have it on a automatic debit if you like, meaning if you know you're going to be using it regularly, then every 90 days. I would recommend, if you know you're going to be using it, to go ahead and do the 90-day count, because it's actually going to save you money over long term than just doing a 30-day bottle. If you think it's something you're just going to use here and there, you really just want to try it, don't want to invest much, then $105 for a 30-day count is good. Considering the actual surgical procedure is on average about $3,200. That's an average. Like I said, doctors, if you're listening, a patient does not have to have a visual field done for this. Because remember, we're not proving that it's medically necessary. It's nothing that is billable under insurance. It is non-invasive, it's non-surgical approach to a lid droop. So all those additional things that you would normally have to bring the patient back for to be able to do, you don't have to do that in order to be able to help your patient. So this is a game changer. It's a game changer because it allows optometrists to get into the space to provide aesthetic services for patients. And it's a game changer for patients to have an alternative to a cosmetic appearance and a functional issue without having to do surgery. Now, the thing is, if you really like the look and you really like how your eyes look when they're elevated, then it may, give you the need to say, okay, I'm going to go ahead and do a surgical procedure because I actually like it. I see the value. I can benefit from it when it's not considered medically necessary. Now, of course, if it's medically necessary, and I have several patients in my database who have had lidless because the droop has gotten so bad that they having neck issues, headache, pain, because they have to hold their head like this to be able to see, and they're not able to drive comfortably. And those cases are your severe or your extreme cases, like we did over here. Your severe or your extreme cases. And those are the individuals, in most cases, that's medical, and your medical insurance is going to step in for that. So whatever your co-pays, co-insurance, and things like that are, that's what you'll be responsible for. But there's a host of people who don't fall into that range who, get tired of people asking them, are you tired? Are you sleepy? What'd you do today? What's going on? Why your eyes always look like they're closed? That sometimes they shy away from certain events, don't want to do certain things, may not want to speak in front of groups, because they don't want to have that attention on their eyes, that negative attention. And so this is something great to have in your repertoire, your cosmetic repertoire at home, to be able to use. This drop is safe for both men and women. It is not has not been tested in children, so you need to be at least 18 and older to be able to have this drop. It is not designed for children. And so we want to think about droopy eyelids a little bit differently and find another way to be able to assist our patients. So the way that we're going to implement this in our office, patients that are listening, and doctors, if you are currently coming in for a routine eye exam, we're going to assess you as part of our eye exam. So what is suggested, it has a nice little diagram that we have in our office of the different lid appearances. And so we're going to ask you to look in the mirror. And when you look in the mirror, you're going to pick the picture that best describes your eyelid, okay? And so you won't be committed to anything, but let's say you picked an appearance where you fall in here, it will allow us to have a dialogue. So once that they looked in the mirror and they could determine if their eye had a droopy eyelid or not, should they ask their doctor to check? When I go check, or will my doctor? Yes. So usually when you come in, your doctor's always kind of looking at that stuff. A lot of times when you come in, as you're talking and telling us or telling me why you're coming in to see me, I'm examining your whole external face. So we always do what's called an external examination before we do anything. So while you're talking and your doctor's looking at you, they're really looking to see if you have symmetry in your face, if you have an eyelid that's droopy, if the droopy eyelid is more associated with age, or sometimes if you get real fatty tissue that builds up here and the droopy lid is because you have fatty tissue, not because your muscle is weak. We're looking at moles, and we're looking at everything. We're looking to see how wide your eyes sit out from your head. And then when we see things, we have to find a very tactful way to ask you, is this something new, or is this something that you've always had? You know, and I'll usually find a way to work it into exam. I'll say, usually I'm looking at things, this is my job, I'm an eye doctor. So I'm looking at things and noticing things that maybe no one else has noticed. And a lot of times when I notice things, patients are like, yeah, I saw that too, but I didn't know if it was in my head, because sometimes you can't tell if it was something that was there previously. One way to look is go find your driver's license or maybe your work ID that you've had for several years and go compare that picture to what you look now. A lot of times that'll let you know. But the way we'll facilitate in our office is part of our routine exam. So it's no additional charge if you're coming in for an eye exam. We're going to help you examine, take a look at the front part of the eye to see if you fit into one of these categories. And it's going to help us open up a dialogue. So if you fit into one of these categories and you decide that you want to try the drop to see if it is going to make a difference in the way that your eyes look, then we'll have samples where we'll be able to put the drop in. And within 5 to 15 minutes, we'll know if the drop is going to work, and we'll have measurable data. In any event, if it works, we can write a prescription. The only thing what we'll do is, because it is a drop, you know, any medication that is a prescription medication has mild side effects, but there are side effects. So especially if you have any dry eye, or if you take certain systemic medications for like hypertension and things like that, I'll probably see you back in 4 to 6 months just to kind of follow you, just to make sure you're not having any issues. And so look here, it says time is up. So my time is up. And so we're going to take an after photo. So I'm going to turn it around. So what happens, it looks like a mirror. So you can see it looks like a mirror. And it's giving me directions. It's telling me to keep my eyes level. There we go. Okay, so what happens is it wants you to keep your eyes level. So the way that you had your eyes in the initial picture, they want you to do the same when you're doing your post picture. So it takes another picture, and after you take a picture, it's going to do a next, and then it's going to show you this little nifty graph. So it shows you what eye, the change in my eye appearance. So before, my eye was at 4.0 was the measurement. Now it's 4.6. So it did raise my eye. And my droop is very mild. I'm like the only one that can notice my droop. So it does like a summary. So it's actually really cool. So it does a summary. So as a patient, if you have a severe droop, before you leave, you'll know if the drop is going to work. And so the thing about it, doctors, it doesn't save the image right now. This is a new platform. You aren't able to export it. They're figuring out a way to be able to do this in a HIPAA compliant way. So if you want to have this for the record, you'll basically just take a screenshot or take a picture of it to be able to upload into the patient's chart if you want to be able to do that. But there's some measurements regarding before and after that you can put into the computer. Just write it directly into your EHR. But it's pretty nifty. It's pretty cool technology. This actually comes with your samples in the event that you want to offer this in your office. Right now in the Atlanta area, I'm the first doctor in Atlanta, Smyrna area to have this this service option for patients. This was very important for me to have as part of my eye spa. And so my eye spa, we treat dry eye, but we also offer cosmetic and aesthetic options for patients. And we try to do a non-surgical approach in a lot of things that we do. One, because in this state, optometrists are not allowed to do surgery. And then two, there's a lot of patients who want options for things that are not surgical based. And then if they decide or if they have to get surgery, that can be a second line of defense versus the primary line of defense. And so this is really great that this medication is out. A lot of people don't know about it just yet because, like I said, it came out just recently this summer, all the COVID, the elections and everything, and they're doing a slow release into the market. So doctors, if you haven't had a rep call on you just yet, don't worry. They're making their rounds. If you happen to have someone that knows someone that has it, it definitely helps. Now I do have a contact in the Atlanta area who is a territory rep for RVL, UPNEEQ in the area. And what they usually require you to do, they're going to send you some information so you can read up on it. They're going to send you all the studies. They're going to send you all the tools to be successful in practice with this drop. And so patients, this is a win-win. Very, very minimum, hardly any side effects or things that you need to be worried about. Like I said, it does make your eye feel a little bit dry. I'm a dry eye patient, so what I will be doing when I leave here, which I will encourage my patients to do, is just put some tears in just to hydrate your eyes, so that way you don't have any potential exposure, keratitis or anything like that from the drop. And it keeps your eyelids open. I can feel like my eye always felt like a little lower. I can feel that it seems like it's wider. And so that gives you that younger appearance. So if you want to have a younger, wider looking eyes, this is the option that is not permanent and that's not surgical. Another thing for patients of color to have a non-surgical option, there's no risk of scarring, there's no risk of keloiding. Everybody's skin does not heal the same. So a lot of people of color, if we have an option that's not surgical based, then we always want to at least hear about that option because we don't want scarring, hyperpigmentation of our skin, and we don't want any keloiding of our skin. So this is a great alternative. So, and if you're not coming in for an eye exam, then sorry, unfortunately, I just won't write a script for you. I don't want to write a script for anything unless I already know the overall health of the eye. So if you've already had your eye exam for the year and you want to come in and be evaluated and see if you're a candidate for this, then there will be a minimum office visit that I will need to do just because now you're going to be a patient of my record. So there'll be some boxes that I'll need to check off in order to make sure that, yeah, I've got your eyes wide open, you looking cute, but then you got all kind of us stuff going on. And once you sit in my chair, I'm responsible for it. So I just saw a text message come in. So I'm responsible for it. So we will make sure that we go ahead and evaluate. So it'll be a small office visit that we'll need to do, and they'll be able to quote those prices. We'll do the same thing. We'll assess the front part of the eye, see how your appearance is, have a discussion. Just make sure the front surface is healthy enough for you to be able to take this drop. If you're already a patient that has severe corneal issues, severe dry eye that is affecting the cornea, or any other severe ocular surface disease that is affecting the cornea, then more than likely you will not be a candidate for this. All those things will need to be dealt with first before you can start taking this drop. So the name again of the drop is called UPNEEQ, and it is a new drop by RVL Pharmacy, and you cannot walk into your CVS pharmacy. Your doctor who wants to be able to offer this for you does have to kind of go through a little process to speak with the rep, the territory manager, read over some information, just kind of look at some studies, and then they'll bring out everything that you need to have, and they'll train you and your staff so that you're confident in prescribing the drop. And then for patients, the drop is not billable under your insurance. And so if you're going to get a 90 count bottle, it's $225 for 3 months. And if you're going to get a 30 count bottle, it's $105. And those prices are always the same. The benefit of having a private pharmacy is that they can control the cost of this drop so that it's affordable. There's a lot of drops on the market that you can walk into any pharmacy and get. And I have patients call me back with some obscene prices that I've heard for some of these drops. And I don't control the price of medications, but it's difficult to get things that you need or want to help with overall health or cosmetic appearance if it's super expensive. So this is a great option for entry level or mild to moderate droopy lid. More severe cases, you can qualify for medically necessary surgery. Outside of that, it will be considered cosmetic, so this is a great option prior to having a surgery. So if you have any other questions, you can put them in the comment box. I'm going to look here. Let's see who we have here. So we had Samantha, Abby, Dr. Wright. Dr. Wright, do you guys have this at your school? I believe you are at, I think ICO. So a lot of the institutions have these, especially if the school has a like a dry eye center. My colleague that was able to get in touch with the rep quickly, she is in one of the optometry schools, so she was able to get in contact with somebody very quickly. And let's see here if there's any other questions. All right, so there's no other questions. So next week I'm off, so I'm only here the 1st, 2nd, and 3rd Sundays at 7 p.m. So actually I'll be back, I believe, right after the holiday, and we're going to have a very special guest with us. So in December we have 3 special guests with us in December. The first Sunday in December we are going to have Lexi, who is the CEO and founder of Headquarters, and we're going to be talking about hair loss and lash loss. So hair loss from the crown to the lid. And then the 13th of December, we'll have Dr. Perryman, who is the dry eye master, and she's out in Seattle, Washington area, and she is the dry eye master. So she's a super dry eye diva. So we're going to have her out. We're going to be talking about dry eye and IPL, which is intense pulse light for treating dry eye disease, and I'll be able to chime in on a new IPL that's available for people who of color, so that we can get treatment as well, but not to cause any issues with our skin. All right, so tune in next week, and thanks for joining.